Okay, so we are going to review the fetal pig anatomy with this video. So first thing, I'll just point out some of the more obvious structures when you first look at the pig. Right here we have the heart, and of course, just like we've learned before, there's the left atrium up here, the right atrium, the left ventricle, and the right ventricle. Surrounding the heart, we have the lungs right here and here. Beneath that is the diaphragm, which in this pig has been a little chopped up, but it's this little flap of tissue right here. And the reason it's chopped up is because that completely separates the thoracic chest cavity from the abdominal cavity. And so that has to be sort of cut in order to open the pig up effectively. Just below the diaphragm, we have this large organ, which is the liver. If we lift the liver up a little bit, hiding down in here, right there, it's kind of stained a weird color in this pig, but this is the gallbladder attached to the liver, because the liver produces the bile and the gallbladder stores it. Beneath the liver, we have the stomach. This little thing that looks like a leech is called a spleen. We actually didn't talk about that in this class, but that happens to be the spleen. If we lift the stomach up, underneath that, you'll notice this cobblestone-y looking structure. That cobblestone-y looking structure is the pancreas. And then, of course, the intestines. The small intestine is this region right here where it's pretty crinkly and I guess we'll stick with crinkly. This is the small intestine. And then here, where it's just a little bit smoother in appearance and not quite as wavy, this is the large intestine. And then that large intestine eventually turns into the rectum, which is going to carry waste out of the body. So then we'll kind of move back to the top part of the pig. If you open the mouth, you've got the hard palate and the soft palate. That sort of separates the oral cavity from the nasal cavity. And then this little flap of tissue is the epiglottis, which closes over the airway when you swallow food. The tongue, obviously, and then these little scratchy bumps back here and up here, those are called the papillae, filiform papillae. If we lift that up, you can see this fairly rigid tube right here. This is the trachea. That's the airway for breathing. And then right above that trachea, the swollen region, is the larynx. Underneath the trachea, if we kind of push that out of the way, below that we see the esophagus. And the esophagus is a muscle that can squeeze food through. So the esophagus can be kind of flat like this because it's going to squeeze the food through using muscular activity, whereas the trachea needs to be wide open in order to allow air to go through. If we look at some of the, well, let's go down here. If we pull the intestines back, we see the kidneys here on either side. And you can see some blood vessels. You've got the renal vein in blue and the renal artery in red going into the kidney. And then coming out of the kidney is this tube, which is the ureter. And then that tube leads to this structure. It's actually kind of embedded in the umbilical cord a little bit. That is the bladder. And then the urethra is the tube from the bladder out to the exterior of the body, and that kind of goes down into the pelvic area there. This happens to be a male pig, and so you can see the testes here. We cut into the scrotum, and there's the testis is right there, and they're not exposed, but the vas deferens would connect that testis to the urethra eventually. Blood vessels. I like to start here with the heart, and if I pull all this out of the way, you can see this large blood vessel coming down. That arch is the aorta. So the aorta arches out, it comes down, and then it follows all the way down here to the lower end of the pig. And then you can see it branches. So these external branches are called the iliac arteries, which are in the hip region. And then the iliac artery, as you can see, continues on and becomes the femoral artery down here, and then it's not exposed, but eventually it gives rise to the posterior and anterior tibial that we learned about, but won't be on this particular assessment. You might wonder about these internal branches. These internal branches, as you can see, are going into the umbilical cord. So these outer ones, though, are the iliac. In terms of the veins down here, we have the inferior vena cava, which again comes down from the heart. And then just like before, it's a little obscured here, but they also branch into the iliac veins and then eventually the femoral veins as well. Up top, if we kind of reorient ourselves using the aorta here, we can see that coming off the aorta, there are two different branches. This first branch, just flung something. This first branch is the subclavian, and that subclavian, it's a little bit hard to see, but it actually comes kind of around the rib cage here, and eventually goes to the arm, and in the upper arm, it's the brachial. So on a test situation, I'd try to make this very obvious. So if the pin is way down here coming out of the aorta, that would be subclavian. And if I wanted you to say brachial, then I'd put it way over here, so it's really obvious. This other branch coming off the aorta is called the brachiocephalic. And then that branches into blood vessels that eventually go up to the neck. They're not stained very well, but this is one of them. This is the left carotid artery, and then there's a right carotid artery here. And then that brachiocephalic also branches to eventually lead to the other brachial artery going to this other arm. The veins going in, you've got the superior vena cava, which is this large vein going into the heart. And then eventually that superior vena cava is fed from these jugular veins, which are the veins that come down from the head. So I think that's a pretty good overview.